So I think it's important for people to recognize that we do have some control over this. There are certain things that you can start doing now that are helpful, and certain things that people have been doing that are not helpful. And so try and provide some guidance on what you should be doing. In terms of supplies, so we know masks, the general public does not need to wear a mask unless they themselves are sick with symptoms. The masks only help with preventing transmission to other people if you are sick. Wearing a mask when you're out and about in the community is not going to be helpful if you're healthy, and also takes away resources from healthcare system that is really depending on these to protect people in healthcare facilities.
And take care of patients that get sick.
Exactly, for healthcare workers who will be in very close contact with people who are sick. We do recommend that people should prepare themselves, prepare their families. So that involves things like making sure you have about 2 weeks worth of food available at home in case you get sick and you aren't able to go out to the grocery store, or should not go out to the grocery store because you risk transmitting infection to others. That's a 2-week supply is adequate. We're not encouraging people to hoard or buy copious quantities of food, but a 2-week supply is reasonable to have on hand at home. Make sure you have some cleaning supplies at home. Again, a reasonable amount to last for a few weeks to help with cleaning those high-touch surfaces if you do become unwell. Make sure you have some supply of any prescription medications that you take that can last you for a couple of months, 2 3 months would even be reasonable, to avoid making unnecessary trips out to the pharmacy or other places like that during this period. That might vary depending on what medications you are and how stable they are, but I think is a reasonable thing for people to do. And I think we should talk to our families, talk to our neighbors, talk to our people in our community who might struggle a bit more if they come down with this illness. So check elderly members, keep an eye out for the people around you and try and help out where you can with them. I think those are the things that people should focus on doing now, and will prove helpful in the coming weeks.
So we know that people are not very good at washing hands in general. What is the correct way to wash hands? And is hand sanitizer adequate? Or if you have an option for both, which would you pick?
Sounds good. So one thing I didn't mention when we were talking about the virus specifically is this virus has what we call an envelope around it. That makes it quite susceptible to hand sanitizer, alcohol-based hand rub. So both are a good option. The important thing is really to just do it. Wash your hands, and wash your hands frequently.
Right.
The situations where we recommend specifically soap and water are if your hands are visibly dirty. So if they're greasy or they have dirt or something on them, definitely soap and water is preferable in that situation. The proper way to do it with soap and water is 20 seconds. So the time it takes to sing Twinkle Twinkle Little Star or Happy Birthday twice will get you to about 20 seconds. To use soap, lather all the surfaces of your hands. We know that people miss common areas, so the backs of the hands in between your fingers and your fingertips are the most commonly missed areas, so making sure to focus on those. And then to rinse your hands off with cool running water. Using very hot water is not recommended. It can be dangerous in terms of causing burns, and it doesn't make your hand washing more successful. So using just a comfortable water temperature is what we recommend.
Okay.
Alcohol-based hand rub, as I mentioned, is effective against this virus. The important thing with alcohol-based hand rub is to use enough that your hands stay wet for at least 20 seconds. If 5-10 seconds into it your hands are completely dry, you need to take another squirt and keep going, because the longer the time of contact, the better, more effective it is.
So apply very liberally and rub
all
your
over
hands
the
very
surfaces
briskly.
of your hands.
Sounds good.